The CDC is warning travelers to take more precautions. This is due to the spike in cases of monkeypox. And Dr. Kumar joins us to talk more about this and why we're seeing it now. Good morning, Dr. Kumar. How are you today?
I'm doing well, man. It's good to see you too.
So first of all, none of us want to play alarmist and make our viewers overly worried or concerned if it is something that we should not be concerned about. So where do we stand on that situation? Just hearing the word monkeypox in itself sounds kind of scary.
Yeah, no, that's a very, very good point. Let's first mellow down the conversation because it's in the news all over the place. It's on comedy shows and people are talking about it. This is not another pandemic. It's not another epidemic. It's not COVID. What this is an infectious disease that's quite rare, usually limited to Central Africa. And now we're seeing a worldwide spread, but the numbers are really, really small. You know, across the world, about 100 cases in the United States, 1 confirmed and maybe 7 suspected cases. But it is an unusual disease, and that's why it's raising people's awareness. And because of the pandemic, I think people are frightened of any new infectious disease that erupts, and that's probably the reason for concern.
Oh, absolutely. The public in general is a little more aware of viruses and infectious disease, what have you, which is a good education for all of us. So, as we get into the summer season, in terms of traveling, what sort of precautions should we be taking, and does it also depend, to your knowledge, as to where we are going, that we should be more cautious?
Yeah, so the way to answer that question is to dive deeper into monkeypox. So it's a virus that's a cousin of smallpox. And the way it's transmitted is through very close contact, household contacts, bed partners. It isn't sexually transmitted, but that's the first kind of close contacts that through which it's spread. People that it's been characterized in gay men currently, but it isn't spread through any kind of sexual interaction. But certainly bed partners and sexual partners have very close contact for a great amount of time, and that's how it's spread, through close contact. What it does is it's just like smallpox in the sense that you have a prodrome where you have fever, headache, muscle aches, the usual things that wouldn't distinguish it from any other infection, but then you get this rash that erupts. You know, this rash that starts out flat and then it starts bumping up and then you get some pus erupts from it and then it scabs over. And that entire process can take about a month, you know, you can be infected up to 14 days before you start exhibiting symptoms. And then this rash comes along and then it goes over. The mortality rate is extremely low. You know, it's usually less than 1%. So the death rate isn't high, but it can spread. And what we're seeing is because this is a very unusual virus and we're finding more and more people coming down with it, the risk factors are, of course, being exposed to somebody that has it. And currently the people that have had it are somebody that's been exposed in Europe or in Africa that's brought it over. We don't know where it started, but perhaps there's theories, some rave parties in Europe when a lot of people had close contact and now that these people are traveling. And so that's how we presume that it's spreading.
When we often talk about viruses, we talk about practicing good hygiene, but is that going to be everything that we can do to prevent it? I think the word I'm looking for is prevention.
Yeah, no, it's not that. It's recognition. You're not going to be able to prevent it because it's going to be close contact with somebody, and you can wash your hands all day long. And if your bed partner has it, if your son or your husband or your daughter or your cousin who's coming over to stay for 3 days has it, you're at risk. It's very close contact that you're going to get it through. So what we're doing is educating, and really first, like the first thing you said, is dampen down all the discussion, right? This isn't another epidemic. We're not going to die from it. We're not going to go into lockdown because of monkeypox. But it's an unusual virus that's spreading across the world. So we should recognize the signs and symptoms. And if you start having it, you should go see your doctor. The way we're going to treat it is because smallpox vaccine works for this. Rather than vaccinating the entire population, the plan now is to do ring isolation. You know, if you really have a confirmed case, then those people that have close contact to that person can get vaccinated. And that's the plan. And, you know, the U.S. has 100 million doses of smallpox, vaccine, which still should cover this. And so that's kind of the plan for it. And by raising awareness and recognizing what the symptoms are, you know, decreasing the worry that it's going to be spread like hayfire. That's what we're going to do here.
Yeah, like you said, recognition, awareness, education, 3 key things we should remember right now. Dr. Kumar, thank you so much. It's always good talking to you.
You too, Amanda. Thank you for the time.
And if you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. Also, don't forget to check out his website, drkumar.com.